We have constructed the following example to help guide your learning strategies for evaluating medications. You are currently working as an outpatient dietitian at VGH. Miss D has been referred to you for counseling regarding her type 2 diabetes diagnosis as well as for high cholesterol. Miss D has had diabetes for a few years and is currently taking several medications for her conditions. She has been feeling unwell for quite some time. As a new dietitian, you are wondering how to approach this case. Let's take a closer look at the case study. Miss D is 40 years old and she weighs 87 kilograms. She has type 2 diabetes, high cholesterol, and does not check her blood sugars. She works a busy office job and a sedentary lifestyle. You conducted 24-hour food recall. This shows that for breakfast she has a large double coffee and a muffin. For lunch she has a large takeout chicken salad and a fruit smoothie. For dinner she has pasta, and in the evening she snacks on potato chips. She eats out for almost every meal except for 3 dinners per week. She is currently taking metformin bi-daily, Lantus once daily, and Lipitor once daily. Her lab values show her hemoglobin A1C at 10%, LDL at 4 millimoles, HDL at 0.9 millimoles, and triglycerides at 3 millimoles per liter. Let's take a look at a step-by-step process to approaching this case. Step 1 is to assess her lab values. Her hemoglobin A1C is at 10%, which is elevated due to poor diabetic control. Her LDL is at 4 millimoles per liter, which is above the desired 2.59. Her HDL is at 0.9, which is within normal limits. Her triglycerides are at 3 millimoles per liter, which is elevated above the normal range. Now that we've identified abnormal lab values, let's look at her clinical status. Step 2. Assess her clinical status to determine the etiology of her abnormal lab values. Miss D has type 2 diabetes, which is currently not controlled, and she does not check her blood sugars. She has a BMI of 30 and leads a sedentary lifestyle. Miss D has a lack of nutrition knowledge, which is leading to poor diet. She has a reliance on fast food, and this relates to her high cholesterol with elevated LDL and triglycerides. What questions should we ask ourselves about her medications? Step 3 is to evaluate her medications. What is the role of each medication? Have they been given? Have they started taking the medications? Are they taking them as prescribed? How does the medication affect their clinical status? And how does it affect their nutritional status? Are there any diet concerns? Now let's take a closer look at which medications she is taking. What is the role of each medication? Make sure to use credible resources. These can be found on our Wikipedia page. Metformin is used for type 2 diabetes to control blood glucose levels by suppressing hepatic gluconeogenesis. Lantus is a long-acting form of insulin which lowers blood glucose levels. Lipitor is a statin which reduces levels of LDL and triglycerides in the blood while increasing HDL. Question 2. Have they been given the medications? Are they taking them as prescribed? In an outpatient setting, you will need to ask the client. Question 3. How does the medication affect their clinical status and their nutritional status? Metformin is used clinically to control blood sugar levels and lower hemoglobin A1C. Lantus is used clinically to help control blood sugar levels and lower HbA1c concentrations. Lipitor is used clinically to increase HDL while decreasing LDL and triglycerides. None of these have an impact on nutritional status. Question 5. Are there any diet concerns while taking these medications? None of these medications should be consumed with alcohol, and while alcohol is not shown on her food recall, this is an important reminder to have. Lipitor should not be consumed with grapefruit products. Now that we've looked at the case, where should we go from here? Step 4 is to create a PES statement. What is our primary concern? Improper blood glucose monitoring related to lack of nutrition-related knowledge, as evidenced by elevated hemoglobin A1C concentration. As we have evaluated, the medications she is currently taking are not our primary concern as a dietitian. Step 5. What are your nutritional recommendations? Our main focus should be educating Miss D about a diabetic, balanced diet, monitoring and trying to reduce her intake of fats while ensuring adequate consumption of carbohydrates spread throughout the day. We should discuss better diabetes management and the importance of checking blood sugars, looking at other alternatives to eating out, while encouraging frequent healthy snacks, especially before bed. We can use A1C concentration as a marker for improvement. By following these 5 steps and taking a look at the bigger picture, you can see that medications can be easily incorporated into any assessment. It is important to remember you are the nutrition expert and to evaluate a patient's medications, as they could have an impact on nutritional status, but they may not always have nutritional relevance.